Hi, my name's Mary. I came into the office for neck pain and back pain. I also had dizziness. I would pass out. Passing out, that was in college. I would be walking through the halls at school and I would just like hit the floor. So that was really hard and really scary to pass out. With the neck pain, driving was really hard because like checking my blind spots and stuff would kill my neck.
So what I'm looking for is any type of break on the instrument, and that is going to determine the exact location of where the subluxation is. We're getting that break at C2. In the mid-dorsal, we can see this breaking here. Once again, we're feeling for any inflammation and restricted range of motion. Once again, feeling for motion restriction and any type of inflammation. What I'm feeling for is any type of inflammation and motion restriction with the vertebrae below. No one above. So the other things that we'll note is any type of hypertonic muscles. And what happens is when you're subluxated and you're restricting the mental impulse from the brain to the brainstem to the body will try to splint itself with muscle spasm and hypertonic muscles. So we can compare side to side and see which one's more tonic. So we confirm on the x-ray to make sure that our findings with our instrumentation are correct. And then when we set the cervical spine, we need to set that from the inferior to the superior. So that's where we're setting that in a lifting motion. So we want to get right under that second cervical vertebrae and take out the slack right on the spinous process. What we need to do is we need to lock the pelvis to stabilize us to be able to set the lumbars. And when we take out the slack, we're taking out the slack from the posterior to the anterior. Go ahead and breathe out. And we're just setting it. So when we're setting this off the transverse process. That's the only way we can set this straight through the line of the disc. The spinous process won't work. Okay, breathe out. So what we want to do is scope over those exact segments to make sure there's a change in that instrument reading. Right now that C2 has gone to the other side. If I keep going over that, that'll come right down to 0. And our lumbar reading comes to 0. So what we're doing is we're freeing up this flow right here at the brainstem, allowing the normal mental impulse, a normal flow of life through the brainstem to the body, into the brain, without any type of nerve interference to that. That will allow the body to perform at its peak potential, and it allows the body to overcome any type of symptoms or conditions that it's dealing with. That's the power of chiropractic. It's incredible.
Since coming in to see Dr. Kometz, I've had a lot of improvements with my neck pain, upper back pain, that's completely gone. I also, things that I didn't know were going to be fixed, like my allergies. I had really bad allergies, that's gone, and I have not had a dizzy spell since. Now that I get chiropractic care regularly, well, one, driving is easier. I'm less stressed, I sleep better. I also don't have to take allergy medicine anymore, so I used to have to take allergy medicine to try and control all my allergies. I don't have to do that anymore. I don't have to take medication for dizziness and passing out. Chiropractic is awesome because, one, I don't have to go to the doctor as much. I don't get sick. I don't have to take medicine all the time. I feel better, I sleep better, I have more energy. I like it just because life is better.